Right now, many of us are engaged in a very worthwhile discussion about health care and health insurance. These are immensely important topics, and I look forward to working with all my colleagues to pass health reform this year. But in these broader discussions, it's easy to forget that the best way to become a healthier country with lower health care costs is to prevent Americans from becoming sick in the first place. A great place to prioritize wellness over sickness comes in our prevention of diabetes. Today, 24 million Americans suffer from diabetes, and the epidemic is getting worse. If we don't make some changes soon, the prevalence of the disease will double over the next 30 years. The annual cost of diabetes in our country is expected to reach $338 billion by 2020. Right now, 57 million Americans are what's considered pre-diabetic. That means they are at risk of developing the full-blown disease because they have high blood pressure or high glucose levels. These statistics include over 1 million adults and 92,000 youth in my state alone. These are Minnesotans who may find out tomorrow that they have become diabetic. And we know that diabetes may be and can become debilitating and require costly medical interventions, from daily injections of insulin all the way to amputations. We know how devastating this disease is from the stories that we hear when we're back home. Just this week, I was on the floor and shared the story of Liz McCaskey from Minneapolis. She lost her job in September and is 58 years old, my exact age. She lives with diabetes and was just diagnosed with kidney failure. She's paying close to $20,000 a year for her insurance and trying to live on $1,000 a month. If we could help people like Liz avoid the pain and suffering that comes from diabetes, we would be a healthier, more prosperous country. The good news is that we can help Americans avoid this costly and debilitating disease. Research has shown that pre-diabetics can avoid full-blown diabetes if they receive access to community services like nutrition counseling and gym memberships. These are proven to cut the risk of developing diabetes in half. I am pleased today to be offering legislation with Senator Lugar to ensure that pre-diabetics have access to services that will stop this disease in its tracks. The Diabetes Prevention Act is based on an NIH research study done in partnership with the YMCA in Indiana. The study showed that a 16-week intensive lifestyle program can prevent diabetes and cost less than $300 per person, less than $300 per person per year. Studies have shown us that this investment can save us money within 2 to 3 years. The Minnesota Department of Health has been working with our local YMCAs in Wilmer, Rochester, and Minneapolis to implement this program. We've got a diverse group of instructors who speak Spanish, Hmong, Somali, and American Sign Language. They include parish nurses, dietitians, and community health educators. All of these folks are helping community members to eat healthier and become more physically active. And for the lucky people who get to participate in these programs, it's working. They're losing weight, getting healthier, and avoiding diabetes. But right now, these efforts are in a drop in the bucket because the epidemic is so great. With this bill, we will replicate this cost-effective program and improve the lives of millions of Americans. This bill will help communities across the country to set up diabetes prevention programs on Indian reservations and rural areas and urban centers. And ultimately, health insurance companies will be reimbursing for these services because prevention saves money and it saves lives. This is an investment in our nation's future. I look forward to working with my colleagues to enact this important legislation. Thank you, Mr. President, and I yield the floor.